6 weeks or so ago, just a little soreness in the legs for 24 hours and got through that. I encourage everybody to follow the CDC's latest recommendations and get boosted as well. For folks that are concerned about the side effects of a vaccine or a booster, those side effects are nothing compared with getting the virus. So please consider that as well. Now, another tool at our disposal is testing. I know many people made testing part of their Thanksgiving celebration, whether they stayed home or where they traveled. We saw our test numbers go up here this past week or so. Also, I want to thank our public health team for recently providing over 300,000 free home rapid tests to our residents. So testing is another regimen we want to keep doing. And even if you've been vaccinated, it's a good idea to be getting tested on a regular basis, especially if you're traveling. As for Omicron, we're obviously staying very vigilant to Omicron entering our community. You see how it's moving quickly throughout the world and now quickly throughout the states. So it's just a matter of time before it visits us here locally, and we need to be prepared. We'll be looking at the data as it comes in and communicating with you all along the way. As we think about this and get anxious about a new variant, let's just remember we got tools to fight against it now. A year ago, approximately, was when the very first vaccines started to roll out. So when you think about the massive progress that has been made in this past year with vaccines, that should give us hope that we can get through this, but only if everybody does their part. Okay, we also have built up an amazing group of partners around this. When you think again against a year ago, our healthcare system, our nonprofits, our nurses, KNA, Kentucky Nurses Association, has been so incredible, and all of our nurses have never stopped stepping up in the midst of this pandemic. So what we can do, obviously, is help them by getting vaccinated and tested. All right, so Dr. Sarah Moyer is our Chief Health Strategist. Everybody knows Sarah by now, and Director of Louisville Metro Public Health and Wellness, and we appreciate the good work of you and your team. Dr. Moyer, take us through your thoughts this morning.
Thanks, Mayor. So unfortunately, we are still on that roller coaster that is COVID, and unfortunately are back into a steep incline of cases going up. So looking at that dashboard, we added 2,211 cases last week, just about doubling what our cases were a week ago.
Every family,
our daily incidence rate went from 24 to 41.
That's why we have U-Box.
And our testing is showing that our positivity rate has been increasing as well, as now at 9.24%.
We can store it or ship it. How?
And deaths, while the dashboard shows 53, there were 6 reported in the week of 11/28 to 4,
at your pace.
and individuals 49 to 76. The state is still catching up from the last surge, and so many of those you can see on that dashboard are reported earlier in the year. And if we scroll down to hospitalizations, our numbers are inching back up here as well. Through yesterday, we had 166 hospitalized for COVID, 41 in the ICU, and 26 on a ventilator. And we know that we all really want COVID to be over, but unfortunately it is still here, and the threats keep increasing with new variants on the way. We know that all of our cases so far in Louisville are still the Delta variant and already causing this big surge. So just really concerned with this on top of flu, which we also know is here. Gonna have just a very hard winter ahead of us. So now is the time to remember what we know works. And so that is masking and spacing and getting vaccinated, most importantly, as well as testing. So if you were someone who stopped wearing your mask after you got vaccinated, now is the time to put that mask back on when you're in indoor crowded settings. If you were someone who wears a cloth mask, now is the time to upgrade to a surgical mask. You just get a little bit more protection. Trying anything that we can just to maybe make sure that COVID is not spreading in our community. I'm going to pause there, Mayor, because I think you have a few other questions, and I got 2 more slides I'm going to show as well.
Well, you mentioned flu. So any early indications on how we're doing with flu?
Yeah, flu season has started. So unlike last year where schools were closed, we were all staying home, restaurants were closed at this time of year. That is not the case right now. Fortunately, it's great to be back to a little bit of normalcy. But because of that, flu season has started. Numbers have really increased, probably about 400% in the last week. So it's never too late to get a flu shot. But if you have not gotten it yet, today is the day to go get that as well. You saw that 11% of our hospitalizations right now are due to COVID. And so the hospitals are still at that red capacity level here in Louisville. So anything you can do to help keep yourself and your loved ones out of our healthcare system right now is really important.
And I'll never forget the day that you and I first stood up, I think it was in March of 20, and said, okay, we're getting our first cases here locally of the virus. When we now think about the Omicron variant, how will we find out when Omicron is here in Louisville?
So the CDC and here locally have really stepped up monitoring and surveilling for variants. We work with University of Louisville in monitoring the wastewater, and so just that's very passive. No one has to do anything. Testing our wastewater for variants as well as COVID levels. And so when you look at this graph here, this is the levels of COVID in our wastewater since August of 2020. And you can see just last week, that last bar there, how it almost doubled from a month ago. Really increasing. Levels are highest that they've been since last winter before we had a vaccine in our community. So there is a lot of COVID going around. And so if you are not vaccinated or have a weakened immune system, Delta or the new variant that's coming is going to find you. And I know I got distracted from your question. So let me get back to that real quick, and then I'll go over this slide. Not only is the wastewater looking for levels of COVID, but it's also monitoring for variants. And as of last week, it's still 100% Delta, and hoping to get this week's results back later in this week. And if there's any changes, we will let the public know. As well as there are a few labs in town that samples automatically get sent for sequencing just to surveil. So about 5 to 10% of samples are getting tested to see if the variant is there as well. And so watching that, and we get those results reported back to us. That takes a little bit longer than the wastewater. And so usually the wastewater we get back faster, but monitoring both, and we'll let you all know if we see anything here locally.
Yeah. And this is messages we're sharing with everybody in the community, but it's especially going to the unvaccinated, right? When you think about where the virus is circulating through, it's through a smaller number of people, right? I mean, people that are vaccinated occasionally get the virus, but not nearly as much. So what do you think's driving this spike that we're seeing right now?
Yeah, so I mean, a lot of combination of things. One, people are moving more. If we look at our mobility data, we are back up to almost pre-pandemic. Moving, traveling, going out to the stores, going into work, that has really increased in this last month. And the more people interact, the more COVID spreads. Two, vaccines starting to wane, and Dr. Hartlands is going to go over the vaccination data here in a minute. We know that everyone that qualifies, that is everybody over the 18, has not gotten their booster yet, and that makes a difference as well. As well as new variants waning immunity from natural infection as well. And so we are seeing breakthrough cases as well as breakthrough deaths. And if Scott, if you don't mind pulling up that slide that you had there a minute ago, I just want to verbally go through that. So this is the same as the state puts out every week, but just for our Jefferson County data. So in Jefferson County, Dr. Hartlands will go over in a minute, we have a much higher vaccination rate than the rest of the state. And so with that, we also have a higher rate of cases and hospitalizations and deaths and are fully vaccinated. But with the smaller percentage of people that are unvaccinated, they still are more than 3/4 of our deaths, hospitalizations, 80% of our cases. And so that small percentage of people in our community that is not fully vaccinated is majority of our cases and deaths still. 25% of our deaths, or 54 of them, have been in fully vaccinated. Almost all of these are people over the age of 70 with multiple medical conditions. And so definitely, if you're under 70, that vaccination keeps you out of the hospital and keeps you alive. If you're visiting family and friends that are over, that are more elderly, especially if they're in a nursing home or are frailer, please make sure you are doing a test before you go see them, and you are wearing that mask even if you are vaccinated, because COVID is spreading and people are still getting really sick, even with vaccinated. But that said, the vaccine is very effective for everyone in preventing deaths and hospitalizations.
All right, Doc, unless you have anything else to share before we flip it over to Dr. Hartlands?
No, we've got some good numbers with the vaccine data, so I'm glad she can share that with us as well.
Okay, so joining us now is Dr. Sarah Beth Hartlands. As we all know, she's our Associate Chief Medical Officer and has been on the front lines fighting COVID. So, Dr. Hartlands, good to see you.
Thank you. So I'm briefly going to go over some vaccine data before we move on. So we've now given over 1.5 million doses of vaccines here in Jefferson County, and that brings us to a 70.2% rate of residents who have had at least one dose, and 60.5% who have completed their series. One thing to note is that the young kids, the age 5 to 11 group, recently became eligible, and so they are only now starting to show up in these statistics. The ones who got vaccinated basically on the first day when it was available are just now reaching their fully vaccinated status. So when we look over at the graph on the right, the orange is the first doses, blue is second doses, and you can see that we had a bump in those back in, they kind of bottomed out around July, a bump in them around the fall when Delta first started to rise. And we're seeing an increase now again with first and second doses, the orange and the blue, probably multifactorial. So the kids are starting to show up in that data. We have over 6,000 kids locally who have completed their 2-dose series, which is awesome. And we do also have, more employers and things who are incentivizing vaccination in various ways, and that is also perhaps driving an increase in primary series uptake. The sort of bright green dots there are the booster doses, and I'm happy to say that we have an increasing number of those going out. As Dr. Moyer said, pretty much anyone who's over the age of 18 is now eligible. If you got Janssen or Johnson & Johnson for your first dose, you need to be 2 months out from receiving that dose. And if you got Pfizer or Moderna, you need to be 6 months out. So other than the timeline, everything else, the only thing that is needed for eligibility is your age. So pretty much anyone can get one. You can mix and match. So if you got Pfizer the first time, you can get Moderna. You can get J&J. You can switch around if you feel that that's something you want to do. The CDC's advice is to get the same booster, but they do allow mixing and matching for personal preference and convenience. And for most adults, there's not a significant impact. Kids 5 to 11 are now eligible. We have seen a great rollout for the kids in this age group with multiple events. Our partners at JCPS have done a great job getting vaccines to kids. They gave their second doses to a large number of kids this weekend. And then we also had some great community events this weekend as well. This is one from yesterday held at Miners Lane Elementary. with the LUVAX team, the Kentucky Nurses Association, and La Casita Center, all working together to provide not only vaccines, but also other support services for our Latinx community. And you can see I was out there drawing up doses and working at the pharmacy station myself. So it was a lot of fun. And we had over 300 folks served on Sunday at that event, as well as 100 or so at Americana on Saturday and a good number at Wesley House on Friday. So we're seeing some uptake in booster doses. We're serving the whole family at events like that. So mom and dad can get their booster while the child gets their first vaccine, and everybody can get it done all at the same time. And it's great to do in preparation, especially for the holidays, especially, Dr. Moore mentioned we do have an increased incidence of COVID, and we're just waiting for confirmation that Omicron is here. We are certain that it is coming. So.
And Doc, even though, you can't get double vaccinated by the holidays if you haven't started, you still get a lot of protection from getting your first shot, right? So you'd recommend to folks, there's no reason not to get your shot right now. You can still get a lot from that first one.
Absolutely. The first shot is definitely better than nothing. And if you have not gotten your shot, it's not too late. There are many, many places that you can get one. Same thing for boosters. If you haven't gotten your booster yet, there are many places you can get them. So we've got the vaccine information site pulled up here. Our LUVAX community mobile clinics are noted here, and you can see which ones serve kids age 5 and up, and then which ones also sites. And you can also use vaccines.gov or text your zip code to get Vax to get information about where vaccines are available and when what product they're offering at each site.
Okay. So we talked about the first shot, then talk a little bit about the booster. Somebody's saying, look, I got my 2 shots already here, Doc. I don't need to get my booster. I'm in pretty good shape. You get exponential protection when you get the booster, correct?
Yeah, so it's extra important, as Dr. Moore mentioned, for our older folks who may have immunity that wanes over time. So everyone over 18 is eligible, but I would say most important for those over 65, those who live or work in high-risk settings. So if you live in a crowded space, if you work in healthcare where you're getting exposed often, that sort of thing, those are all important. And if you have medical conditions that make you at high risk for severe infection, hospitalization, or death from COVID infection, then it's also super important for you to get a booster as well. There's a new study out of Israel this week. Israel was sort of an early adopter of the booster model. And so their data is a little bit further along, and they showed an 86% reduction in the odds of testing positive for COVID when you compared those who got the booster dose versus those who only had the first 2 doses of the Pfizer product. So a significant reduction in the odds of testing positive for COVID if you get that booster shot.
Yeah, that's an amazing number. So if you've gone to the effort of getting the first 2, go ahead and get that 3rd one as well. Okay, let's talk about now. Gosh, we've all learned so much here over the last 18 months, 20 months about the virus. And so we have a new player on the scene, the Omicron variant. So we're really pleased to be joined by our community and one of the country's foremost infectious disease specialists. That's Dr. Mark Burns of the University of Louisville Health. He's been a tremendous partner in helping us get quality, science-backed information about the vaccines, and is just always there to help. So Dr. Burns, we appreciate you. He's here today to talk about Omicron and answer any questions we have about that. So Doc, I'll just start you off at the beginning and then you can share with us, but remind us again, what's a variant? How does it come about? And why are they such a concern?
Okay. Well, thanks, Mayor. Thanks for having me. What a variant is basically viruses replicate. That's how they survive. And they need a living source, such as an animal, a plant, or a human being, to replicate in. And when they do replicate, they don't always replicate exactly. In other words, they make mistakes sometimes when they replicate. Sometimes those mistakes are just by chance. Other times they are as an adaptive mechanism to something that may be pressuring them. So in essence, a variant, particularly the ones that we've been seeing, are changes the virus is trying to make to survive, because it's feeling pressure as defenses are reckoning against them.
Okay, so when you think about Omicron, lots coming together. If you just want to kind of give us the high level summary of what we think we know, and I think it's think at this point in time, right?
Sure.
And what about Omicron is so potentially challenging?
Okay. Well, just to give you a little background, for everybody, just sort of bring everyone up to speed. On November 24th, the new variant of SARS-CoV-2, initially known as the B11529, was reported to the World Health Organization. Um, these specimens came from South Africa and Botswana. They were specimens taken on November 11th and November 14th and reported to the World Health Organization. And by November 26th, the WHO renamed the B11529 as the Omicron variant and also labeled it as a variant of concern. By November 30th, the CDC acknowledged this variant as well as a variant of concern. And by December the 1st of this year, we had our first case in the United States in San Francisco, California. Omicron, again, as indicated, is a variant of this. And right now, there's still a lot that we don't know about Omicron. It's again, SARS-CoV-2 variant. It's been reported to have at least 50 mutations on the virus, and 30 of those mutations have been within the spike protein of the virus. And in particular, at least 10 mutations around what's called the receptor binding domain. That's sort of the business end, if you will. That's what hooks on to our cells. It's sort of the key, if you will, to open up our cells to allow the virus to get into our cells to replicate. So that's in a nutshell, is kind of what Omicron is. Right now, again, because it's so new, we're still learning about Omicron. Now, there have been some speculation about it. There have been some papers on preprint servers that have indicated it might be more transmissible than the Delta
Garrison
variant,
and Garrison
which is
Heating and
still
Air is an
the
official
predominant
Toys for
variant
Tots
here
drop-off
in the US.
location.
Toys for Tots
There's also been some reports that it may be a little more invasive
Drop off
to the
new
vaccines.
unwrapped
But
toys
again,
at Garrison and
these things
Garrison
have
Heating
not
and
been
Air
proven
on
out
Mooresville Road
just
in
yet.
Huntsville.
But right now,
Huntsville
even as we
is home
speak,
to many great
work
things.
is
The
being
Dash
done
Bananas,
to
Redstone
answer
Arsenal, the
three
Rocky
major
Center,
questions.
but Huntsville
Number
is also
one,
currently
how
home to what
transmissible is this
believed to
variant?
be the oldest
Number
veteran
two,
in the state
how
of Alabama.
severe
Major
is this
Wooten not
is
only
this
does
variant
Wooten turn
to
105
us?
today, but
And
he
then
has
thirdly,
also
and
received the
probably
French
most
Legion
importantly,
of Honor.
are
Nice decoration
our
done in France. Our
vaccines
Nixon Norman
effective
has more.
against it? So that's
A
kind
night
of where we
full
are
of
with
veterans,
Omicron up to the
birthday
moment.
cake,
Now,
honor,
just so you know,
song.
it's been detected in, the last I counted, it's been 38 countries, and it's probably
A night
more than that
for
by now.
Major Wooten.
And
Also
here in the
known as
U.S.,
Pop Pop.
last I
Now
counted, I think it's been
105
up to
years
about
old
18
and now a
states.
recipient
It
of
has
the
not
French
been
Legion
detected in
of
Kentucky
Honor,
just
the
yet.
highest
However,
decoration
one of
given
our border
in
states,
France.
We
that
are
would be
very, very
Missouri,
proud of
it
him,
has
and we're
been
very
detected
proud to
there.
call him
So
our Pop Pop.
honestly,
And
Mayor, I look
I feel
forward
like the
to
community,
start showing up
feels like
anytime.
he's their Pop Pop, and
Right,
we embrace
right.
that and love that.
And in any
Well,
event,
Pop Pop
there
and
is
a
no
proud
harm in
veteran
getting
of World War
a
II.
vaccine.
Wooten sings along to a song
Absolutely.
he and a
Right
friend
now,
Wood
as far as
Newton
what
made
we
about
can
his
do
time serving.
to
closely.
fight against Omicron, it's the same thing we've been doing to fight against SARS-CoV-2 in general. That is, number one, first and foremost, getting vaccinated. Okay, those people who are unvaccinated need to be vaccinated. And secondly, right behind that, those who are fully vaccinated, if they're eligible to get their booster, they need to be boosted. And then also, the things that have gotten us to this point now are good old public health mitigating measures, are masking, social distancing, washing hands, making sure we're in good ventilated areas,
Dedicated
trying to
is the
stay
word
away
that
from
comes to
crowds.
mind when thinking
Those
of
types of
food.
things,
Dedicated
all
to
those
not only his
together
family.
are going to
My
help us get
dad had
through
passed away
the
in
Omicron
2016,
and at this point,
and
just about any other variant
you
that
could
comes
just
along.
tell he had a new
Yeah.
mission in
All right,
life, and
thanks.
that was to make sure that we were
Kathleen, let's
okay.
go to our
His
media
country.
questions.
His take on
Okay,
it
lots of
was, my
good
country needs
questions,
me.
Mayor. Our first
And
one is from Deb
this is,
Yetter.
I've been called to do this, and I
Does
will
the
do
health
this for my
department
country.
have the
So,
percentage of
Wooter's
vaccinated
family,
people
the
in
people of
Jefferson
Huntsville,
County
and
who
now
represent
the
new
country of
cases,
France
hospitalizations,
all
and deaths?
recognize Major
And if they're
Wooten
higher
as a
than the
hero.
state percentages, why?
105-year-old
Dr. Hartledge,
hero.
can you take
Nixon
that one?
Norman, Fox 54 News.
Yeah, so we looked at the chart a little bit ago, and you can see that roughly 20% of new cases, hospitalizations, and deaths are in folks who are vaccinated. This is pretty closely correlated with the state's data. Their numbers are pretty similar. If there are differences, for one thing, as Dr. Moyer said, we have a relatively high vaccination rate here in Jefferson County. So there are just more vaccinated people out there. And then also Jefferson County has an unusually high percentage of, for example, long-term care settings, people who live in nursing homes or healthcare settings, who may be at higher risk as well. But just to clarify, that if there are 20% of new infections that are vaccinated, that does not mean that a vaccinated person has a 20% chance of being infected. Your individual risk as an individual who has been vaccinated remains really quite low. For people without other risk factors, it's probably 5% or less.
What do you say to the people that say, look, see, these people are vaccinated, they're dying too, they're getting sick, so I don't need to get vaccinated?
So the vaccines still are very, very effective at preventing hospitalization, ventilator need, ICU admission, and death. The majority of folks who fall into those breakthrough cases that turn severe, the majority of that population are at extremes of age. So those over 70, immune compromised, or perhaps have other contributing medical conditions as well. So for the majority of the population, the vaccine is going to be very effective at keeping you out of the hospital and keeping you alive.
Thanks.
Thank you, Dr. Hartledge. Dr. Moyer, April Rickert with WFPO wants to know, with the wastewater testing, how will the health department respond if Omicron is detected there first? And to clarify, wastewater samples are showing 100% Delta and no other variant?
So first, you're correct. As of last week, it's showing 100% Delta, no other variants, and waiting to see what those samples come back this week. And responding, we will let the public know the exact same measures that prevent infection in Delta work to prevent the spread Omicron too. And so just another reason to double down on your getting vaccinated if you haven't yet, getting your booster. Keep wearing your mask, keeping your space, stay in well-ventilated areas. If you are going to be visiting somebody, especially somebody over 70, or if your zip code has a lower life expectancy, would say even over 50 or 60, please make sure you are testing to do that. We still have some of those free test kits available at our community sites. And so check out our website to see where those are. If not, stock up at with the home rapid tests, as well as there are plenty community sites. If you're affiliated with JCPS, they've got testing sites at every middle and high school, Sunday through Thursday, as well as many community partners that are testing. And so no excuse not to do that if you're going to be hanging out with someone, even if you are vaccinated.
Okay, thank you. Dr. Hartledge, April is also asking, does the 72% and 65% vaccinated include all who are eligible?
So those stats are for ages 18 and up. We will probably make an adjustment to that in the coming weeks as the kids become a significant part of the numbers. If you break it out by age, in reference to specifically those who are fully vaccinated. Our seniors took an early lead. They became eligible first, and they also were very motivated for vaccination. And so the age group 65 and up is 85% vaccinated. The 18 and up group is about 70%, 12 and up drops to about 65%. So I expect that we will adjust the age ranges for the dashboard in the coming weeks.
Thank you, Dr. Hartlands. And Sarah Ladd with the Courier-Journal is asking, what is the number of flu cases confirmed in the city? Dr. Hartlands, do you have that, as well as maybe how many flu cases were confirmed last season, which is a question asked by Paul Miles of WHAS?
Yes, absolutely. So we do track flu cases. I'll start with the last case, the last question there. For the 2020 to 2021 season, which runs through the end of May, I believe, we had 184 flu cases in the entire state of Kentucky for the season last year. And in Jefferson County, we had 19 for the entire 2020 to 2021 season. The flu cases are also significantly on the rise right now. At the moment, we have 58 cumulative cases for this season in Jefferson County. And that there are 98 confirmed cases for the entire state. But notably, last week, we confirmed 17 new cases, and or that would be 2 weeks ago. And then last week, we confirmed 31. So the trend is upward for flu cases as well.
And what do we see in a normal year, Sarah?
So last year was very low.
Right.
And in previous years, an annual total would be more like for Jefferson County. I'll pull up the one from the year before. Yeah, so in the year before for Jefferson County, we had over 8,000. So last year we had about 100. The year, so 88 times reduction. And then this year we're still very low compared to 8,000, but they are trending upward. And you certainly don't want to get infected with both at the same time. I'm sure that that would be miserable.
Thank you. This last question is from Deb Yetter at the Courier-Journal. She wants to ask you, maybe Dr. Burns, this would be a great question for you. Can you elaborate on what puts a vaccinated individual more at risk for, I guess, a breakthrough case for COVID?
So, shall we join everyone?
Yeah, dishwasher's on.
That a vaccinated
That's all?
person would be more at risk?
Yeah. So, David, huh?
Oh, okay.
Okay.
I think Dr.
Give it to me,
Hartlands
Dad.
elaborated earlier.
I like him.
It's
So far.
older people with
Okay, I'll take that.
underlying conditions, but what are your thoughts?
Well, I mean, certainly, Dr. Hartlands is correct. You know, older individuals are at higher risk, generally because, number one, they're older, their immune system is older. And secondly, they tend to have a lot more comorbidities in general as a younger person. But I will say this, though, you know, someone who's not only fully vaccinated, but at this point boosted, you know, provided that they've gotten a booster shot, they're actually even better protected, even against variants, in particular, even the Omicron variant. And the reason is, what happens when you're fully vaccinated and you get boosted, your levels get up so high that you can get what's known as a spillover type protection.
We are very, very proud of him. We're very proud to call him
in this
our
particular
papa.
case, the Omicron
And
variant
I
or
feel
other
like the
variants as
community,
well.
you know,
So
feels like he's
I would
their
say
pop-up, and
someone
we
who's
embrace
fully
that and love
vaccinated
that. A
and
proud
especially
pop-up and a
boosted,
proud veteran
they are
of World War
well
II. Wooten
protected
sings along to a song he and
against
friend Wood
against
Newton
all these
made
things
about
at the
his time
moment
serving.
right now.
Listen closely.
Dr. Hartlands, do we have any evidence of boosted people being in the hospital or deceased?
I don't have a number for that, but it is quite rare.
Yeah. Okay. Maybe we're early in the process, but I was just curious if you knew. Okay.
And I just want to add too with we just started analyzing data of our local cases, and it seems that those that are vaccinated, the most common pre-existing conditions that you end up in the hospital still, or one of the deaths is hypertension and like any cardiovascular disease, hyperlipidemia and diabetes. And so those diseases are really common in those people that are overweight or obese. And so just a marker there. And so if you've got family members that are overweight, take medicine for hypertension, diabetes, please be extra careful this holiday season being around them, even if they are vaccinated.
I will do this for my country.
So Wooten's family, the people of Huntsville, and
Okay,
now
thank
the
you,
country
Mayor.
of
That was
France
our last
all
question.
recognize Major Wooten
Okay, well,
as a
thanks,
hero.
Kathy, and thanks,
105
Dr.
hero.
Burns and
Hero. Next to
Hartlands
Norman,
and
Fox 54
Moyer. And
News.
for today's program, you know, a lot of dynamics taking place now with our numbers going back up, even without Omicron being in the community yet. So a time for great vigilance and reminding everybody of the need to get vaccinated. And we will continue to keep everybody informed, obviously, and announce when Omicron shows up in the community. It's just a question of when, not if. Want to thank all of our public health team, our physicians in the community, our nurses in the community. This has ended up being a real marathon with, we don't know when it's going to end. So just thanks everybody for hanging in there. And for those folks that want to call our folks healthcare heroes, what you can do to be our own healthcare hero is take somebody to get vaccinated today that has not been vaccinated, especially as we head into our holiday season. So thanks everybody for joining us. Thanks to the media for continuing to report on this in such an effective manner to get the word out. So everybody take care. Have a safe and healthy week.